Hi, I'm Dr. Jan Jaffer, and this is Got Teeth, a patient-centric monthly podcast featuring local health experts. So I'm with Dr. Gill today. Dr. Gill, thank you for meeting with me. You are an addictions medical doctor here in Calgary, and you have a nonprofit organization that you help people with. So tell me a little bit about that.
Yeah, absolutely. Thanks so much for having us here. We provide addiction and mental health services across the continuum of care. So, our special focus is people who don't speak English and people who are treatment resistant. So, as an addiction doctor, I'm a trauma therapist, and 6 years ago, I had the idea that we can serve these groups of people that are not getting services. A quarter of Alberta doesn't speak English as a first language, and so seeking addiction and mental health services that are beneficial there's a lot of barriers to that. So 6 years ago, I decided to open NOM, which is Northeast Addiction Mental Health Center for Holistic Recovery, and we started as a community addiction clinic, and then slowly over time, as people come, we see, this person needs groups, weekly groups. So then we open up weekly group therapy. And then some people would come to the groups, but they'd be homeless in between the weeks. But they would really want to get help. And so then we said, okay, well, let's give them a home. Let's give them a house. Let's do inpatient treatment, which was a bit of a interesting journey.
Yeah, challenging for sure.
And so then slowly we've added, day programs. Some people, they have a safe place to stay, but they don't have anything to do during the day. So then we've added more and more services to create a continuum of care. From outpatient to inpatient, and multiple levels of intensity, so that people with barriers to accessing high quality services, particularly around the addiction side, they can be treated. We have a focus in trauma, obviously, as a trauma therapist, and immigrant communities are very, very they suffer from a lot of trauma. So then we're holistic. So holistic means mind, body, and soul, and families, and communities. It takes a village to do this kind of work, and so we have a lot of partners. And we had an urgent need to fundraise, and I'm so grateful that Trex stepped up and helped, because that actually. That goes towards making Calgary a safer community. People were struggling with addiction, mental health. They can be functional. They can heal. They do heal. Miracles happen every day. It's and so this support has gone towards helping us, bring families back together, get people back to work. And get people sober, and not just back to their old life, but back to a new life with new connections, new people, and so it's really sacred work, and it's really
that's amazing, because obviously, there's a lot of challenges that people are going through. Mental wellness, like you said, trauma, addictions, and it's nice to see somebody that can step into that role, or with a team of people, because obviously you have a team behind you that helps you do all of this work. And we know that getting people back into functioning in society so that they can add to what we have, because we're lucky to be in Calgary, we're lucky to be in Canada, and we're lucky to have all the things that we do, and so we want to make sure that we continue to make the communities better, right, and the people in the communities better to help. So if somebody, I guess kind of two questions. One, if somebody is suffering or challenged, how do they find you? And then the next part is or if somebody wants to donate or help you with the work that you're doing, how would they also find you? Is that the same sort of way?
Yeah. So there's two general groups of people that often require our services. One is people struggling with addiction, mental health, and the other is usually the family members of the people who are suffering from these issues. And so both, these illnesses belong to whole families. We don't live in isolation. If a family has a loved one that they're worried about, they can go to our website or call our intake number, which is 587-777-4722. And if a patient or a client wants help for themselves, they can also call the intake number. And what happens is we have programs that serve both, and sometimes these illnesses have been going on for 20, 30 years, so people they're not sure how to approach or what they can do to help. There's a lot of hopelessness. So we have programs to support families in that and help them sort of maybe ready their loved one to get help. And then we have programs, obviously varying levels for any client, ranging from inpatient to outpatient. And I'm actually pleased to announce that in about a month we'll be opening our women's program. So we have inpatient men's housing already. And then we'll have inpatient women's housing, so we can really provide the spectrum of care to more people.
Oh, that's fantastic.
And the second question, how to donate. Is there a need? Absolutely, there is a need. Organizations like ours, we can only function if society supports us, and on our website is a donate button, so www.namrecovery.com and /donate. So there's a button there for a secure donation platform. Any little bit counts as we're going to expand our services and our offerings to include the higher intensity levels of care. As you can imagine, there's levels of care. So some people who need the highest levels of care, sometimes they need a lot of clinical support to help them kind of stabilize. So then we're always looking to expand our continuum of care, and so donations would be very welcome.
Right. Well, that's great. I mean, thank you for the work that you're doing, the help that you're giving to Calgarians. I mean, obviously necessary stuff. And thank you for taking your time to come and let us and some of our patients and friends know about the great work that you're doing. It's great to meet you.
Oh, and thank you and bless you for supporting and doing this. In Punjabi we call it seva, selfless service. So it's very nice to see Trek supporting. So thank you.
You're welcome.